Welcome to the Why Did I Get Cancer podcast. I'm Deborah Herlax-Enos, a small-town girl turned TV nutritionist and healthy living expert. I design health programs for the average guy or gal, including those average guys named Metallica. On September 1st, 2020, I was diagnosed with breast cancer. I asked every oncologist the same question, why did I get cancer? But none of my doctors had good answers for me. I wanted answers, and that's why I started this podcast. I want to help you to lower your cancer risk and provide self-care tips for those in the battle. I'm getting answers, and I want to share them with you. I had a huge takeaway with this episode today. I interviewed my acupuncturist. Her name is Dr. Amanda Tieu. She mentioned to me about this incredible study where they did acupuncture on people who were about to get heart surgery. Well, those people recovered faster, got out of the hospital quicker, and used fewer drugs to help in their recovery. That, to me, is just shocking that acupuncture can help somebody who is about to get surgery. And my second takeaway was how acupuncture can be used for pain. Now, I've been using it for pain for many years, but I love that Dr. Amanda actually had some research studies to back this up. So give today's episode a listen. I know you're going to enjoy it. So today's podcast is with Dr. Amanda Tieu, and she's actually my acupuncturist. And I've never talked about acupuncture before, but I am a huge fan. And just a quick story, probably 28 years ago, I was snow skiing, fractured my leg in multiple places, almost completely blew out my ACL. And I was single and didn't have great health insurance and owned a business. So I couldn't take the time to go and get surgery. So instead, I got acupuncture and physical therapy. And 28 years later, I've run 5 half marathons. And this is after my sports medicine doctor said I would never walk again without a limp. And run 5 half marathons. I'm surfing 3 or 4 days a week. So you don't have to convince me that acupuncture is amazing. But I'd love to know, Dr. Amanda, what makes you so passionate about acupuncture?
Yeah, first of all, that's an incredible story. We always are scared when we hear about something like that, but then to be able to come back from that is just amazing. And that's exactly why I'm so passionate about acupuncture, because things like surgery, all of that is very scary for some people. And of course, there are times where that's warranted, right? But then if someone prefers to try every avenue before surgery, why not go for it? Especially with acupuncture. Acupuncture just has little to no risk, honestly. And it helps with pain. It just helps with stress. It helps with so many things. And it's crazy, as I kind of journeyed into learning acupuncture and then even working as an acupuncturist, I just fell more and more in love with the modality. It's just incredible.
So on our appointments, I always seem to have my liver is always off. But when you talk about that, you're not necessarily talking about the organ. You're talking about my liver meridian. And if I'm confused, I'm sure other people are going to be confused too. Can you tell us more about what's a meridian and how many do we have in our body?
And I mean, I honestly always confuse myself too, because I always try and change my answer, because it's not something that I can explain Western medicine wise. It's just something you kind of know as an acupuncturist. Maybe it's also because I'm newly minted and I didn't get to perfect it, but meridians are kind of channels that run throughout your body. And so we have 12 classic meridians, give or take a few of special meridians. And so when we influence one end of the meridian, we influence the whole meridian. And so that's why people are always wondering, why do you put points, on my foot when I have elbow pain? I'm like, we're also, trying to look at the meridian because we want to clear up that channel, so to speak, and, make everything free flowing. I hope I don't lose people there, but, and that's essentially what it is. Just channels throughout your body that we put acupuncture points in to influence what we want in the outcome.
Okay. So there's a liver channel, there's a heart channel, there's a gallbladder, I'm assuming. Is it kind of like the major organs?
Yep.
Okay. That is really fascinating. I always was wondering, why do you put a needle in here, but I have shoulder pain?
Mm-hmm. Yeah.
And then you also have a needle, I think it goes between my eyebrows, and you call
Yes.
it the glass of wine because it's very calming
Yes.
and kind of gets rid of anxiety and helps me
Yeah.
to sleep and all
Yeah.
those things. So it sounds like, it increases circulation to an area that is possibly
Mhm.
injured. So when I go back to, my greatest example, which was my
Mhm.
broken leg, I felt like it really helped me with pain
Yeah. Yeah.
management.
And there's
Yeah.
actually little nuances on that in terms of what exactly is happening. And obviously it's very complex. But so what it boils down is to when it influences the neighboring nerves, they do show that it can actually promote the type of macrophages that are anti-inflammatory, as well as inhibit the macrophages that are inflammatory. And vice versa, on the neuronal level, it can actually inhibit the release of excitatory neurotransmitters, is what they signal to the brain to be like pain, pain, pain. And it actually releases inhibitory neurotransmitter, which actually blocks the pain signals, therefore creating that like pain relief, that analgesic effect. There's so much more intricacy with that, but that's kind of like boiling it down.
So inserting a needle into a body part actually signals to the brain to turn down inflammation? Is that what you're saying?
Yeah, essentially, yes. And through all the little intricacies of like activating things, inhibiting things, almost kind of modulating it in a sense.
Okay, so I'm already learning things I didn't know. And so if let's just say you have tennis elbow. Do the needles just go around that one area, or do they kind of go in different parts of the body?
Yeah. So obviously, yes, local is always best when they have a local pain. But as an
Hmm.
acupuncturist, we are always looking more on a holistic level, a constitutional level. So, for example, if someone has chronic elbow pain, but also chronically stressed or not getting the right sleep, things like that, then we put points all over the body to not only to help regulate that. And because if someone's getting, better sleep and having better regulation and stress, that decreases inflammation, that decreases chronic pain, all that kind of stuff. And so we work to build on that.
Okay, well, stress is something I talk about all the time, and I tell you, just about every health expert, oncologist, alternative health practitioner that I've had on the show, stress is, in their opinion, the number one cause for cancer. So, with that said, how can having acupuncture or traditional Chinese medicine practitioner in your life, how can that help your body to either manage stress, mitigate stress? Tell us more about that.
Yeah. Well, because we know with acupuncture, it's very common to help with anxiety and stuff like that. And so with using acupuncture, it influences the neurotransmitters again to release things like dopamine and serotonin to help with sleep and help with feeling less anxious. And so, therefore, getting regular acupuncture will optimize your system to keep responding that way and therefore reduce your stress load, which, like you said, will then reduce inflammation, will then reduce like the cause of diseases such as cancer.
Right. So it's really a cascade of responses
Mhm.
in your body. So if you can get acupuncture on a regular basis and create those what we call happy hormones. I had a
Mhm.
guest a few weeks ago, Dr. Kelly Turner, and she talked about this really interesting study with breast cancer cells in a petri dish, and then they dropped oxytocin into the petri dish, and the breast cancer cells were destroyed, through apoptosis, which is literally popping the cancer cells.
Wow.
So any way we can get more happy hormones in our body is a really good thing.
Yeah. Yes, exactly.
Yeah.
And then acupuncture
Yeah.
has that cumulative effect to the point where the body then starts picking up its own, and you don't have to come for acupuncture regularly. You can come on a maintenance. And yeah, so it's amazing.
Hmm.
And that's really amazing that oxytocin can even do that to breast cancer cells.
Isn't that amazing?
Yeah.
I mean, I love that, our body can heal
Mhm.
itself, but we probably also need to be on a maintenance program. I
Right.
mean, waiting until you have stage 4 fill in the blank, or, you've got a lot of other problems going on. It's probably good to start as early as possible,
Right.
taking care of yourself. Yeah, with self care.
Mhm.
Yes. So I'd like to move on to the topic of other things in, I'll call TCM, traditional Chinese medicine. You went to Bastyr, which is one of the best
Mhm.
universities in our country, probably for the field that you're in. What are some of the other types of modalities you learned there that you use in your practice?
Yeah.
Hmm.
In terms of TCM, oh my gosh, there's so many. There's obviously Chinese herbal medicine, super potent, super well researched, that can combat a lot of conditions. And then we do cupping, a lot of cupping. I'm sure a lot of people knows about that through massage therapy, PT, Olympic athletes. And we use that also to help just relieve pain. And there's little nuances in terms of like chronic diseases and stuff like that. We also do cupping and acupuncture.
Can you tell us a little bit about dietary
Hmm.
interventions? And I've come to you for a few things. Post cancer, I was just running really hot all the time, and I said, "Are there foods I can eat that are going to help to cool me down, heat me up, or even give more energy?" And can you share a little wisdom with us?
Yeah. Yeah. So in terms of TCM in nutrition, we base everything on energetics. If we're looking in that realm, certain foods are cold, cool, warm, hot. I mean, people can common sense, right? Watermelon is cooling, cucumber is cooling. And so we relate that to what a person is feeling. So, like for you, Deborah, when you mentioned, like, oh, I'm just like more on the hot side, and for you on a TCM level, it's like, okay, we need to nourish you. We need to cool you down and then nourish your body fluid, so to speak. And that's a TCM vernacular. And so we apply the person's diagnosis, what they need to what kind of foods they need and their energetics or the type of temperature they are. And so we gave you those body fluids, nourishing foods, those cooling foods to help also just constitutionally do its work. Whereas, hey, you can get acupuncture all you want, but there's also some responsibility that the patient can take on because face it, you can't get acupuncture regularly. And so they can do things at home, like the nutrition aspect and feeding that and addressing that. And so it's amazing. Everything is just boiled down to energetics and temperature and how that can apply to the human body.
So if you're running hot, you're eating cooling foods. I think about, it's very warm in Seattle today, and eating like a cucumber salad actually sounds amazing right now because I'm kind of
Yeah,
sweating, and you're right, it's naturally cooling, and I never really put two and two together like that. And of course,
right.
those fruits and vegetables are available in the summer when you might need to cool yourself down. I know that, we're all really busy, and I think we have just like an epidemic of busyness. People aren't sleeping. We're on screens too late at night. Our energy is just lower. What types of foods would you recommend to somebody who, is really maybe struggling with their energy?
Oh, that's a good question. Okay. So to answer that, it's just gonna be like a
Yeah,
general response.
absolutely.
Everybody is just
Everybody's so
so
different.
different. Yeah, but given what you have told me, stress and sleep and on their phones, for us in a TNCM aspect, and again using the vernacular, that is going to be liver, and then sleep is going to be yin, and then kind of phone and over screen time is blood, and so when we do too much of that, when all that is in overdrive, we deplete
Mhm.
that. So we're just going to offset that by eating all the foods for that. And so blood nourishing foods would be like things that are red. It's kind of similar to like eat what the color is representative of. So goji berries are really good. Datsao is kind of like, what's that? Like very sweet prunes. It's kind of similar to
Mhm.
prunes. That can help with your blood. Yin foods again are going to be the ones that are cooling and nourish your body fluids. Things that are kind of
Hmm.
slippery, like lettuce,
Mhm.
things like that. Cucumbers again. And then in terms of stress, liver. Uh, and I don't mean like yes, you are maybe on a molecular level stressing out your Western liver
Mhm.
organ, but speaking in TCM, it's a whole nother body system with some overlapping features. We also do stuff to help move your liver energy, so to speak. That's going to be like, I think sour foods. Speaking onto specific foods for calming your liver, we're looking at things that have like veins in them. So they're going to be your dark leafy greens, kale, Brussels
Oh,
sprouts, which coincidentally is also liver healthy food. So isn't that kind of funny how they overlap? Yeah, celery.
wow.
So it's going to be also like radishes and spices too, all that to help move the liver stress, to help calm it down. Yeah.
If I don't have food in my fridge, I can go hangry, get hangry really quickly. So here's my pro tip is I always have a good amount of ground beef in my freezer and in my refrigerator. If it's in your freezer, it's super easy to defrost and I can put dinner together so fast. Here's how I used to prep it back in the day when I had like almost no budget for protein. I would cook up a pound of ground beef. Then I would add refried beans to it or black beans to it and mix it up, maybe add a little bit of onion or some garlic. And all of a sudden, my 1 pound of ground beef had grown into like a pound and a half. It's got additional protein, which I love. It's got a great hit of fiber, which I also love. Most Americans are fiber deficient. And it's going to have a good dose of nutrients. So here's a great deal that's going to help you to do all of these things from my friends at ButcherBox. So they have a great special going on right now. And what it is if you sign up with my link using the code ENOS, you can get 2 pounds of ground beef per month for free for an entire year. If ground beef isn't your thing, you can get 3 pounds of chicken or a pound of premium steak tips. And honestly, you know how I feel about ButcherBox. I love that they know where the protein comes from. They use great animal husbandry techniques. And again, I'm just really happy that this company is sponsoring this podcast. They really do a great job. So go to the show notes. You're going to get my link. You're going to get the coupon code. And I hope you enjoy the protein as much as I do. And again, when you're talking about move the liver stress, you're not actually talking about the organ. You're talking about the meridian that we discussed earlier. Oh, that is fascinating. Fascinating. So maybe a random question, maybe not. Are you saying that to really max out our health, especially from a TCM, traditional Chinese medicine perspective, is it better to be plant-based?
Yes and no. A lot of practitioners still argue about this because
Okay.
yes, plant-based obviously is going to be the best over, refined sugars, all that kind of stuff, because they give you so much property. But
Mm-hmm.
meat also gives you that property too. There are certain meats that are more nourishing
Mm-hmm.
for your body fluids that are also for liver and things like that as well. And a lot of the meat, and I forgot to add this, is really good for nourishing your blood. And we know that through Western medicine wise, in terms of, ferritin levels, iron levels. But there
Mm-hmm.
is a meat aspect to it. But again, it's always kind of like the sustainability, what works best for you, what, your morals, your beliefs, all that kind of stuff. And obviously kind of being a moderation kind of style diet, right? Too much of a good thing can always become bad.
Tell me a little bit about the science behind acupuncture. I'm assuming, acupuncture's been on the planet for thousands of years. Have we studied it?
Right. And yeah, we've also studied it for years more commonly outside of the US because it's been more well established and people are more aware of acupuncture, but we are slowly getting more and more research in the United States. But yeah, there's so much science on it and it was hard not to go down a rabbit hole, but like, for example, I was researching dementia and cardiovascular disease, as well as digestion. I feel like those are typically the top 3 that a lot of people worry about or maybe kind of get stuck around. And so, for example, if we kind of maybe take the topic of hypertension and studying that on a molecular level, again, when we take back the explanation of like, hey, a point in the skin stimulates nerves, all that kind of stuff, there's actually research where it can stimulate the release of nitric oxide and increase the concentration. Nitric oxide allows vasodilation. Vasodilation, therefore, can decrease blood pressure. And so, yeah, it's crazy.
Wow.
And there's even studies of people before they undergo heart surgery. What happens if they get electroacupuncture and see what their kind of recovery time is after? And they would physically measure the troponin levels someone after heart surgery. Troponin is a common molecule that's released from damage, from heart attack, things like that. That's how someone actually knows if you're having a heart attack. They measure your troponin levels.
Okay.
And actually, before getting acupuncture, before the surgery, showed that they had lower levels after the surgery, and they actually needed less drug use, and their hospital stay actually shortened as well. So
What?
if you kind of take that, it's amazing.
Gosh.
Yeah, it's crazy. Obviously, they go down and break down the actual cellular level, what's happening.
I mean, who would ever think you could get acupuncture before a heart surgery and you'd have a shorter hospital stay and a faster recovery? It's crazy. And again, I mean, does science know how it works?
I think we're trying to figure that out. Otherwise, like acupuncture would long have gone extinct, right?
Right.
And a lot of the studies now are more rats. So it'd be nice if we can move forward on human trials. So I'll give you that example of digestion. I think this was a human trial, and might misspeak, but the one that I was reading is they stimulated a point, a very common point that we know is for digestion. And what they did is they measured the levels of zonula and cadherins, as well as mast cells. So the first two, zonula and cadherins, actually help bind up your intestinal tract.
Okay.
That's how you prevent leaky gut. And they actually showed increased concentrations of it after people get acupuncture, specifically of that point.
Oh my gosh.
And then they decreased mast cells. Yeah, which decreased histamine reaction, which decreased like sensitivity, things like that.
Right.
And they would take the cell, they would lyse it, and they would measure the concentrations of it. So we're starting to get there. But it's also kind of like, okay, these are in rats, for example. We do see it in some humans, but then it's also kind of like, then we get into the rub of how do we standardize this, which is hard because acupuncture is not something we can standardize. Patients are not something we can standardize.
Right. And then there's the whole insurance question, which, probably is Pandora's box to talk about. But you mentioned gut health, and that is so near and dear to my heart because, I don't know if you feel the same way I feel, but after my cancer journey and interviewing all these medical experts, disease really starts in the gut. Yeah. So acupuncture can help with gut health.
Yeah, it's crazy. Given what we spoke to before, it can help with constipation, all that kind of stuff, because it kind of helps with peristalsis. They're even starting to research on how it does that. And again, on a molecular level, they see that increases the expression of a particular smooth muscle protein that helps with kind of regulating everything and promoting motility. So yeah, on the Western medical aspect and science of it, we're starting to see that and seeing the benefit of it.
Wow. And so you see all types of patients. And I don't know if you have a lot of people who are focused on cancer prevention. But of course, that's my big driver. And that's why I started this podcast. Can acupuncture help me to not get cancer again?
Yeah. So, that's a very loaded question, but
sure is.
I want to say indirectly, yes. There's a lot of things where there's a lot of research where you can't really make that bold statement of acupuncture can prevent cancer, right? Understandably so, because you have to be pretty confident in something to make that statement. And there are so many factors to it. But acupuncture, I feel like if we were to look on in the lens point of inflammation and how inflammation drives cancer, stress drives cancer, like you said, then yes, indirectly it can, because when we have the inflammation response and it releases all those like inflammatory mediators like cytokines and chemokines that will allow for cell proliferation. And then when that goes overboard, right, cancer happens, tumor growth, all that kind of stuff. But acupuncture can modulate that inflammation, can rebalance things like when we've talked about earlier, promoting cells that are anti-inflammatory and then inhibiting cells that are less inflammatory. And so if we can modulate the inflammation, therefore, then we can modulate the ability to not put stress on the cells, which then can inadvertently lead to cancer. And so that's why it's like, if we look in that lens point, I think definitely.
So it could really help. And it sounds like it's really from the stress perspective. Yes. So it can help to modulate the stress. And most people, I don't know I don't know what percentage of the population who listens to my show um, gets acupuncture. But how often do you need to get acupuncture to have some of these great
Hmm.
responses?
Again, it's always going to depend, right? So if we were thinking preventative lens point, honestly, once a week is always good. In the perfect world, like 2 or 3 times a week is good for acute situations like ankle swelling or acute pain, right? But if we're thinking about just keeping the body up and keeping it as optimal as possible, once a week, maybe even once a month, just some kind of pattern in your body to kind of reintroduce and keep re-stimulating that area to help with keeping, optimization.
And so, would you compare it a little bit to maybe seeing a new chiropractor? And, at first, maybe they want to see you twice a week. And then you eventually get
Mhm.
into a maintenance phase where maybe I go in once a month or, every other month.
Yeah, exactly. I think you definitely summed it up pretty well. You definitely,
Okay.
because if someone has a chronic issue, it's not going to go away after one treatment. Just like we take one pill or
Right.
something, it needs to build up, right? We need to see you
Right.
a little bit more regularly, and then we can
hmm
back off of it and then go into that maintenance
Okay.
phase.
Okay. And then I was on your table a few days ago. And one of the things that I kind of, honestly, I geek out about it is when you take my pulse. Can you talk
Oh,
us
yeah.
through what that's all about?
Oh, yeah. Oh, man. Yes. So I don't know why I forgot to mention that as part of our techniques of what we learn in acupuncture. Pulse is a big thing, as well as tongue. With pulse, each hand represents different organs. And we
Really?
have 3 different locations on each hand that we can kind of determine. People spend decades studying these. There
Hmm.
are pulse masters out there where I've had like supervisors and colleagues tell me where they'll take your pulse for 10 minutes. And
Wow.
I kid you not, they would say, "Did you have an ankle fracture of your left ankle when you were 8 years old?" And people would say
Oh
yes.
my
And that's how
gosh.
nuanced. Yes,
You're
that's how much
kidding.
studying. I'm not kidding. I'm not kidding. There are even acupuncturists who taught me had told me that their mentors would then like are still learning and then would tell them that, and then they were mind blown. Um, yeah,
That's
it's because
shocking.
uh, it is. They study the shape, they study the rhythm, they study the depths of it and what it pertains to each of the organs, and then they make their connections with it. And so, yeah, pulse is a really big
Wow.
thing in TCM.
So the body, it really tells a story with pulse.
Mm-hmm. Yeah.
Hmm.
Yeah. I can say that I'm not quite there yet, but it's amazing.
Well, I know you took my pulse the other day and you were like, "Oh, you seem stressed." And then you put a few needles in, including my little glass of wine one that went right here. And then you took my pulses again. You're like, "Oh, your body's already responded." And I thought, "Oh my gosh, the body rocks, doesn't it?" I mean, the body I I would say my big takeaway from acupuncture and even our conversation is give your body a chance to heal itself.
Mm-hmm.
Put
Yeah.
yourself in a position where your body says, "Ah, this is great." Maybe you're meditating, maybe you're going for a walk, maybe you are getting acupuncture, maybe you're just sitting and looking out of a window and you're watching a hummingbird. You're putting your body into a state where it
Yeah.
can really start to clean up some of the junk
Yep.
and heal.
Exactly.
Yeah.
You're totally correct.
Yeah. Oh, well, Dr. Amanda, this has been such an interesting conversation. And like I said, I do geek out on the pulses. Oh, I know. Before we wrap up, what's the tongue all about?
Oh,
Wait,
yeah. Sorry.
it's only at an acupuncturist office where you can actually stick your tongue out at a doctor and not have
Yes.
somebody say, "What are you doing?"
Yes, it's funny, and it's funny because the past 3 years we couldn't tell people to stick your tongue out, so I totally forgot about it just because COVID, all that kind of stuff. Everyone was wearing masks, and so
Right.
the tongue is also just as nuanced as the pulse. People can do the same thing with tongue. They can study years, decades on the tongue and describe everything. So first of all, we do like the color of the tongue. the coat that you have, and then like characteristics of the tongue. And so it's like, are you more red? Does that symbolize heat? That's the body color of it. People who have digestion issues, and I look at the coat and it's like thick or it's kind of like yellow, that's very characteristic of digestion issues. Yeah, it's really amazing.
Wow.
Yeah, then there's different areas for different organs that we also assess too, and where the characteristics show up on each different side also means something. It's amazing.
There's just so much to learn about
Yeah.
acupuncture. And again, I just love that the body, if given a chance, it'll show you where it's struggling. And
Right.
and then it's up to you with your knowledge to come up with a plan for it. It sounds like you've really seen some success stories with acupuncture.
I have him. I mean, granted that I've also heard of a lot more success stories, and I hope to kind of apply that in my future years of being an acupuncturist. So it's amazing. It's amazing medicine.
Yeah, it really is. Well, thank you, Dr. Amanda, for coming on Why Did I Get Cancer? It was just fascinating to talk to you. And again, I've been receiving acupuncture for probably 30 years. And even back when I had no money, there was a school near my where I lived in Oakland, California, and I would go over to the school, and I got, I don't know, acupuncture for $10 or something, and all the students would jab me, but it was just like, this is what I could afford, and it worked for me. So yeah, I'm a huge fan of acupuncture.
Yeah, and that's awesome. Thank you for having me. I mean, for being able to spread the message of acupuncture and that you're a huge fan. It just really helps our medicine.
It really does. Yes. Thanks again for coming on the show.
Thank you, Deborah.
Hey everyone. A lot of you have been asking me about the products I use on my face. I've never been one to get a lot of compliments on my skin. But I tell you, since I switched over to this product, it's been about 10 years now, I get so many compliments on my skin, and I want to keep that going. So Body Deli is what I use. It's a small company out of Palm Springs, California. They grow a lot of their own produce that they then end up turning into products for your face. Non-toxic. I mean, honestly, my skin just eats it up. So there's a couple of products that I absolutely love. I've tagged them in the show notes. One is the Phoenix Skin and Neck Oil. I mean, I'm at that age. I need to focus on these things. And I tell you, if I don't use this every night, my skin gets so dry. And then the vitamin C serum, I tell you, whenever I put it on my skin, I feel like it's just like taking this amazing vitamin, and my skin just looks better. I get compliments, as I said. My skin kind of just, glows even when I'm not wearing makeup. So I'm a huge fan of Body Deli. Again, the link is in the show notes. Use the code ENOS15 and get 15% off of your purchase. Again, one of my favorite companies, and I hope you enjoy the products as much as I do. Thank you for joining me today on the Why Did I Get Cancer podcast. I've got my shopping guide for all of my cancer self-care items in the show notes, along with information about today's guest and our show sponsors. And don't forget to subscribe to my podcast so you never miss an episode. Keep in mind, I'm not a doctor. I'm just a gal that got diagnosed with cancer and wanted answers. If you need medical advice, please be sure to consult with a medical professional. And thank you for listening.